Good afternoon. Thank you for joining Project Play's latest Youth Sports and Coronavirus webinar. I'm John Solomon, Editorial Director of the Aspen Institute Sports and Society Program. In our first webinar, we explored with key national industry leaders what the future of youth sports might look like in our current landscape. In our second webinar, we examined how youth sports leaders in nonprofits, for-profits, and parks and rec departments are handling key issues during the pandemic. In our third webinar, we identified what kids need now from their coaches, including hearing from kids themselves on their experiences during the shutdown. And now in this webinar, we will help parents understand how their kids can safely and creatively play during the crisis. With organized sports currently shut down, we know from the CDC that kids still need 60 minutes of physical activity each day. One of the positive unintended consequences of this pandemic may be the return of free play. Free play has essentially died in America. Kids no longer grow up playing pickup ball with friends in the neighborhood until dinner time like you and I once did. But now, without the hectic schedule of organized sports, we're anecdotally hearing of more kids and families enjoying playing outside on their own terms. They're taking walks, going for runs, riding bikes, going on hikes, and playing catch. So what are creative ways to introduce free play to youth, many of whom have never tried sports on their own terms? How do we provide physical activity to our kids in a safe manner? And what can parents learn about themselves and their children during that part of the conversation, and we'll be posting related links. Oops. Second, we will be doing, you can log on and using the Q&A and click the icon at the bottom of your screen to send questions to panelists. Our panelists will be answering questions in the final 20 minutes of the webinar. We will email you a summary of the conversation after the webinar. We hope you share that and a recording of this session on social media with the hashtag Project Play and tag us at Aspen Inst Sports. So today we're delighted to be joined by three panelists. We have Omar Vizquel, former Major League Baseball star over 24 seasons, and one of the sport's greatest and most creative defensive players. We also have Ruth Katz, Executive Director of the Aspen Institute Health, Medicine, and Society Program. And we have Dave Andreatta, a reporter at the Rochester City newspaper and a youth sports parent who wrote a recent column titled Coronavirus Sideline Youth Sports, and I'm secretly happy about it. So we're going to begin first with Omar, and we're starting with one of the all-time great shortstops, who in my opinion belongs in the Baseball Hall of Fame, but that's a conversation for another day. We have Omar Vizquel here today because he played baseball with such joy, and he learned this joy as a child by growing up with free play. So Omar, thank you very much for joining us.
Hey, thank you for having me, guys. How you doing?
Doing well. Thanks for being here. So look, this is a tough time right now for a lot of kids without organized sports, but we know there are still other ways for kids to play. What do you see as the value of free play during this time?
Well, it gives us the opportunity to stay active and stay creative, or the things that you have to do to be in shape. You know, this is not new for me. When I was growing up in Venezuela, sometime I misbehaved myself, obviously. My parents used to lock me up in a room, so I didn't have a way to do anything except start like doing weird stuff that we're not used to do in a confinement place. So what did I do? I got a tennis ball and I started throwing it against a wall, and I started like practicing my abilities of getting rid of the ball as quick as I can. I threw the ball against a wall, laying down on my bed, and I start bouncing the ball off my hands. And I started doing push-ups, you know, in between the two beds. I have a brother that sleeps right next to me in my room, and that created a space where I can just push myself in between the two beds. So I started doing push-ups. And also, I used to have a rope and I start jumping rope. So in the same spot, I start jumping rope in the room, and that keep myself active, doing something, even though my parents didn't want me to leave the room. I started doing all these crazy things around it, and I realized that it created a habit of fielding the ball with two hands and bouncing it off my hands, and it helped me out to when I go to the field and play with my friends, these abilities to have an eye-hand coordination.
So is that where you got those quick hands? I mean, you do those drills that I've seen before with how quickly you're able to catch the ball with barely seeing it. I mean, it was just the bouncing of the ball off the wall constantly.
I think it created something in me. If I tell you that was the secret, I will lie to you, because there were a lot of other drills that really helped me out. But in a way, it was something to improve on. I start bouncing it quicker and quicker and quicker and taking a longer time without dropping the ball. So it was a drill that I used a lot. Besides that, if you have the opportunity to have a wall in your garage or something, I used to play with my brother. I used to throw the ball as quick as possible with the wall and try to make him drop it. So that was the game that we play in an everyday basis. Try to bounce it as quick as I can, and obviously you created a feet coordination, hands coordination, your eye following the ball, and all these movements. When I went to the field, I tried to do the same and emulate it. So it was a pretty good way to stay active in the house.
So I think with a lot of kids shut down right now, there are probably a lot of kids or parents who think they can't still be playing baseball in some way or working on baseball in some way because we have to do social distancing. But there are ways that kids can still be active and learning their skills, correct?
Sure, yeah. I mentioned just a couple of them. I've seen some videos of some friends and send me what they do in their free time with their kids, and they basically doing some kind of creative thing where they roll the ball to them and they field it and they roll it side to side and they kind of follow the ball. I seen these really cool balls though that I didn't have obviously when I was growing up. It was called the Incredible Ball. They're kind of like foam, and you can you can use it to hit it inside a room, and the ball is not gonna ruin anything. It's not gonna ruin the wall. It's not gonna make noise. But at least you get the timing of the ball going through. You can work on your swing, and you can do all this crazy stuff inside the house. Something that I didn't have when I was growing up. And the other one is something that is called the Anywhere Ball. These two balls are really cool because you don't really necessarily have to go on the street, and you don't need a net, and you don't need none of this big equipment. You can do it inside a small place and you can still be active.
So I know you have a 12-year-old daughter, right? She plays volleyball. What are you doing right now with her during this time off?
Well, we go in the garage and we kind of like try to volley the ball against the wall, and she can volley the ball back, and we can improve on their technique on pushing the ball up in the air, and also this movement here. I don't know how you call it, but you can also hit it like this, and it's fun. We've been having a good time against that wall.
So, I mean, sports are so structured for kids right now in America, right? I mean, it's organized sports. That's sort of what the whole thinking is about how you play in sports. Wonder if you think that our kids in America need more creative free play games like you and your friends had growing up in Venezuela, right? That's what you just learned how to play on the streets.
Yeah, I think one of the most important thing is like the parents have to participate in some of these activities. I think if you have your dad or your mom to try to maybe roll the balls and do these activities with them, that will make them get more into the workout. I know it's hard sometimes for some parents to kind of do that, but since they're not allowed to leave the house, I think the parents have to participate on that. I remember my mom taking me to all the minor league games. She analyzed the game, she write things down, and then after the game, she asked me questions about the game and all this stuff. So those are good way to kind of like get the kid to do a little bit of activities. Obviously, my dad was the one that take me to the field and he pitched batting practice to me. He helped me with the tee. He put the ball in the tee. He did all these things with me, but everybody can participate in these workouts. One of the things that I didn't mention, John, is like we have this game with the caps of the bottles. I know that it's kind of weird because I haven't seen that game play here in America. We used to collect the caps from all kind of bottles that we find, and we used to throw them to each other. And the cap have this movement of going sideways and going around and stuff. It was pretty hard to hit. And not only that, we use a broomstick to try to hit these caps. So if you have the opportunity, you should try that with your kids. You can do it in the garage. You can do it like in a place where you can throw the caps. Obviously, you can't play this game inside the house, but it gives you an idea on how we stay creative in the small places.
See, I love that because I think just for a lot of kids these days, they don't even know how to play on their own, right? And free play and go out and play, on their own terms. What advice do you have to parents right now during the shutdown to get these kids moving, right? Like to your point earlier, look, many parents are working. It's going to be really tough for them. Kids have a lot of downtime. They're going to be on their devices. How do we get parents to think creatively to be engaging with their kids as well?
Yeah, to support whatever activities they do. It doesn't really have to be baseball, whether it's basketball, volleyball, soccer. How many times you see kids trying to kick a little ball, like going around the house, going around the table. You can see all these little games that you can do around the house. Obviously, you cannot get mad. I think the parents have to put like a time frame where they say, okay, from 4 to 5, we're gonna allow you guys to play around the house, make all the noise you want, and then there's gonna be a time where obviously you have to start doing something else. But all these activities or jumping rope, push-ups, hitting off the tee with these foam balls, throwing the ball against the wall, against using the corners of the wall to bounce the ball twice. All these things, you don't really need that much space, and you also can participate on these drills with your kids. So that's the best advice I can give the parents right now.
That's
And
great.
of
How much
course, you
time are
gotta
you
get
spending?
creative.
Absolutely. How much time are you spending with your daughter each day working on volleyball?
Oh well, we have a big garage, so I can do a lot of things with her. We're doing painting. We're doing a little bit of sculpting. We play volleyball. She have a skateboard. So my neighborhood is kind of new. There is no many houses built around my neighborhood, so I have the opportunity to go a little bit outside the areas and play some games. But if you don't have that kind of space, these are some of the things that help you out and stay active with your kids.
Yeah, absolutely. Well, thank you so much, Omar. Stick around because we're going to come back to you in a little bit for our Q&A. And we now want to look at the health perspective of play. And we're pleased to have with us Ruth Katz, Executive Director of the Aspen Institute Health, Medicine, and Society Program. We're partnering with Ruth's program to develop the first ever cross-sport risk assessment guide that describes how various sport and recreation activities can be enjoyed while minimizing transmission or contraction of the virus. In consultation with leading medical organizations and guidance from the CDC, we are starting with individual activities and have plans to continue to update this resource weekly. The resource will be coming out in the near future, so be looking forward for that, and we'll be making announcements real soon about that. Ruth, thank you so much for joining us.
Terrific. Thanks, John. I'm a big sports fan personally. It was great to hear from Omar. And so it's great for me to be able to join you in my individual sports-minded capacity, but I'm especially pleased that the Institute's Health, Medicine, and Society program is, if you will, teaming up with sports and society in this very, very challenging time. It's great to be here.
Well, we're pleased to have you and want to get some of your insight on this. Wanted to start with about physical health. And so we know the CDC recommends 60 minutes of physical activity a day for kids. But even before many states had the shelter-in-place guidelines, it was hard to ensure kids were meeting that standard. What's the value of physical activity for improved health outcomes, and how can parents help kids be active now, recognizing, as Omar mentioned, some kids simply don't have access to play spaces or backyards?
Exactly. Well, John, for all of us, all the folks listening in the audience today, for all of us dealing with the current pandemic, lots and lots and lots of things have changed. But one thing for sure has not changed, and that's the need for all of us to continue to engage in some kind of daily physical activity. For kids, as you just mentioned, the Centers for Disease Control and Prevention recommends that kids get at least 60 minutes a day, and we should try and encourage that kind of activity continues to take place. Physical activity is absolutely critical, not only for good physical health, but also good mental health and general well-being for everyone, not just kids, but for adults as well. Now, of course, we recognize and understand that engaging in physical activity may be much, much harder right now with everyone, as you mentioned, sheltering in place. And that may be especially true for families and kids for which team or group sports has really been the center of the physical activity that they do on a regular basis. And it's really clear that this pandemic has hit some communities much harder, disproportionately harder than other communities. And I'm thinking specifically now of communities of color, particularly African Americans. This community has been impacted really terribly. And for many kids in these communities, organized sports, team sports, group play has really been the kind of physical activity they have traditionally engaged in. But as you know, CDC and other experts have recommended organized sports, team sports right now are just not possible, again, for kids or for adults. But I'd suggest, and I think we all believe all's not to be lost here, there are activities for kids that they can take up to help them remain physically fit and to build skills similar to the kind of skills that Omar was just talking about, skills that will come in handy or be even improved when team sports actually return. And again, that's true for adults, not just for kids. So access to large spaces. Omar's lucky he's got a big garage, but I'm thinking more about the ability to go outside or access to specific kinds of equipment that you may want to use. They don't have to be the drivers that keep kids and families active. The guide or assessment tool that you just mentioned and that we have worked on with you and your program that we've developed together provides several examples of how this can be done. Free play, which you and Omar just talked about, has already been discussed and is something parents and kids should think about. It's a great example. But bike riding, walking, they're great examples of exercise that people can be doing right now. Even squats at home, or even using canned vegetables that you can use to lift weights right in your kitchen. All those kinds of things are activities that kids and, again, even parents can engage in. But let me just wrap up the answer to this first question with a cautionary note. Regardless of what physical activity people engage in, you have to take into account various risk factors, such as the involvement of non-household members and use of shared equipment. All those kinds of things have to be taken into account. And the guide that we've put together with Sports and Society lays all those kinds of things out.
Yeah, no, that's really good advice. I mean, let's talk a little bit more about this return to play resource, which we're really excited to be teaming with you about. It's going to be coming out really soon. What's the purpose behind this? What to get people to do with it?
Well, the idea behind the resource or the guide is really to provide a tool for individuals and families to be able to assess risk in a variety of common sports and recreational activities. Now, in this initial version, the one that's about to come out very shortly, given that the CDC and other experts have recommended that we do not engage in organized sports right now, the guide that we're about to put out actually starts with individual activities that we've seen lots of families and kids and adults engage in right now, things like walking and running and biking. We have not, however, left out team sports, some of the most popular activities that kids like to engage in, such as baseball and basketball. So we do have risk assessments for those larger activities as well. I should add that we plan to, once the guide is released, We plan to update it with information that we get about the activities that we've already covered in the first version, but we will be adding additional sports, all of which will be done in concert with recommendations that come out from the CDC and the other experts that we've been working with, so that we have a complete guide and up-to-date guide for parents and families to be able to use most effectively.
And then how are the recommendations developed? And then how should people maybe be using this resource, right? There's probably some cautionary recommendations we need to make sure that they understand as they're applying this in their everyday lives.
Absolutely. In addition to what I just mentioned about doing a risk assessment, what works best for an individual may not work best for another individual. But let me make it perfectly clear, absolutely clear, I should say, that the document we're about to release should be treated as an informational resource only. It's not a medical prescription or any kind of medical document whatsoever. It does not offer recommendations on doing one activity over another activity. Participating in one is not necessarily participating better in another. It is simply a guide that provides information so that each individual can make an informed decision or informed choice about what activity he or she wants to engage in, given their own individual characteristics or their own individual situation. In terms of how we actually put it, so everybody's got to keep that in mind. We're talking about a guide, we're talking about a resource, we're not talking about any kind of prescription. In putting together the document itself, it really was a two-step process. First, we gathered the best information that we could, the best knowledge we could from medical and public health experts, as well as information. We sought out information from sports-specific organizations to help us develop the risk factors that are in alignment with the CDC recommendations that we've read about so much, that we have read about so much. After we were able to do that initial round, we had a small medical review team. We gave them our draft, they commented on it, they gave us their suggestions on how we could improve it and revise it, which we have done. So what everyone will find when we actually release the document is what we believe is the best advice currently available on how to engage in these various activities. Again, we'll be updating it in the weeks and months ahead. We'll be collecting additional information to update what we've already got in there. We'll be adding new sports and activities as they, if you will, begin to come online. But all of this will be done in concert with what the CDC recommends, as well as other medical experts, of course, in consultation with sports-specific organizations that we've already been dealing with. So we're very excited about it and think it provides, it's first of a kind, as you mentioned, and we think it's going to provide a lot of valuable information as we continue to remain sheltered at home.
Yeah, and we're really excited about it, and we're excited to be partnering with you and your program as well, Ruth. And again, this resource will be coming out in the very near future, so be on the lookout for that. We'll be sharing it on our website. You'll be able to see it at as.pn/COVID-19 sports. We'll be sharing it on social media channels and also on an email blast. So Ruth, thank you very much.
And we'll also feature it on the Health Medicine Society website as well. So there are lots of places at the Institute where you'll have access. Yeah,
thank you so much, Ruth. Ruth will be answering questions as well here in a little bit. So reminder, if you have a question, please use the Q&A function on the platform to submit one. And we're now going to hear from a parent who is actually secretly happy that the chaos of organized youth sports is on hold. He's enjoying seeing his kids play sports outside on their own for once. Dave Andreatta is a reporter for the Rochester City newspaper in Rochester, New York, and he's a dad and coach of 2 sons. Dave, thanks for joining us.
Thank you for having me, John. I really appreciate being here. I think discussions like these are critically important, and especially right now when we have this unprecedented opportunity really to rethink youth sports, for youth sports parents, youth sports organizations to reconsider their priorities and, take the very best of youth sports and discard what isn't working. So I'm pleased to be part of the conversation.
Yep. So when we talked offline, you mentioned that your household is usually always on the go when it relates to sports. You're maybe sometimes coming back at 9:30 p.m. at night, weeknights from practices, like a lot of people out there. What is life like now for your family, and how are your kids handling no organized sports?
Well, life is a lot slower. I have two boys, ages 13 and 11, and competitively they play hockey and baseball. I'm in Rochester, New York. Hockey's a big sport here in the Northeast, and we felt like we were constantly on the go. Typically, the sports would take up most of our weekends, at least a couple of days a week, and that's with a family of two kids. If you have more than that, the schedule can even be more harried. Life has gotten a lot slower since. And what I have discovered about it is that, we're finding our way and finding our priorities seem to have changed. And I think for the better. Your question was, how are the kids handling it? Well, to be honest with you, they're handling it, I think, remarkably well. They really miss the camaraderie of their teams. Right now, we'd be in baseball season. And again, in Rochester, it's 40 degrees. So I don't miss sitting on the sidelines in 40 degrees. But that being said, we would be in baseball season and the kids do miss their teammates. There's no question about that. But for the first, in New York here, we're about 5 or 6 weeks into this thing, where we've had shutdown orders, stay-at-home orders, and that sort of thing. New York, as you know, has been a hotspot for the virus. And for the first couple of weeks, what was really interesting is my kids weren't playing a lot of sports. They were finding friends on video games and that sort of thing. And my wife and I tend to eschew video games. We really try to keep away from it because we like our kids to be active, like a lot of parents. But it was a way for them to socialize and a way for them to communicate in a way they couldn't otherwise because they were missing their sports. But, they weren't asking to go play catch either. They weren't out in the driveway shooting pucks and doing all of the other things that you might think a kid who plays these types of sports and seems to enjoy them, they've never, ever complained, would be doing. And I think what it said to us was that they needed this break and they relished it and found some comfort in it. And as time has worn on, week 3, week 4, they have rediscovered their sports and they're playing them on really on their own terms and taking ownership of those sports. And they're doing what Omar talked about, what Ruth talked about. They are throwing balls against walls. They're shooting pucks in the driveway. They're rollerblading up and down our street. We sort of live in a suburban neighborhood. And it's a real joy for me to see because they seem truly happy playing those sports. And every chance I get, when the weather permits and I get home from work, we find time to play together and get outside. So they've sort of rediscovered it, but we've been able to have the family meals that we haven't had before. We've been able to sort of just loaf on and watch television at night in a way that we haven't been able to do. And while my kids have always, like I said, they've never complained. They've enjoyed their sports. In some ways, my wife and I are wondering if it was, all they knew, and that there are other valuable aspects to life, like, yes, loafing on the couch and watching TV and joking around with kids that, can be valuable experiences for them. And we're sort of rediscovering it. And I hope other parents are too.
No, we hear that a lot. That's interesting to hear. Because really a lot of kids these days, I have found, and just you hear anecdotally, don't even really know how to play on their own outside, right? Like free play. So you're fortunate that your kids, sounds like they are figuring it out on themselves, how to go outside. But as a parent, do you have any advice? How do you introduce kids to free play? Because we live in such a country where it's organized sports pretty much all the time.
Yeah, at first blush, John, I sort of bristle at this notion of that the concept of free play is something that needs to be introduced, right? I think a lot of people think that playing is something that comes naturally, and certainly when I think back to my childhood, it's something that came naturally to me. A bunch of kids would be in the neighborhood, we'd divvy up sides and play some street hockey or basketball or whatever the game was. And I think that's what you're getting at. And we don't see a lot of that now. I don't think it's for a lack of interest on the kids' part. I think it's for a lack of opportunity. Kids who enjoy sports are mostly in structured programs now, and there just isn't a lot of time for them to play sports to free play. So how do you introduce it? Well, I think it is something that ultimately, even though, like I said, I sort of bristle at the idea that it has to be introduced, I think in retrospect, it is something that needs to be learned, and parents need to take the initiative there and encourage kids to get outside. And when they see kids sort of, you don't want to be watching over their shoulder all the time. That's the whole thing about free play. They need to have ownership over this stuff. But, when you see kids looking like they're not knowing what to do, you have to be the grown up in the room, so to speak, and introduce them to different concepts. I teach a youth coach a youth hockey team. It's been one of the great joys of my life. I absolutely love it. And when this whole thing started, we lost a game. So we had ice time, but a game was canceled, and we didn't have the shutdown orders, and social distancing wasn't a thing yet. So we had this extra ice time, and the question was, well, do we want to use it? Well, sure, we want to use it. It was free. So the team went out there, and there were a few kids on the ice, a few teams on the ice, and they were kind of milling about. And I told the kids, you know what, it's the end of the season. It's March. I'm not going to go out and coach you guys. None of the coaches are going out. You guys just go out and have fun. And at first, for the first 20 minutes or so, it was a lot of skating around and shooting pucks, and they looked like they were having a good time. Then there were kids sort of sitting on the bench, or standing by the boards, or shoving each other, as young boys are wont to do. And it's like they needed this instruction. And I went down to the boards and talked to one of the kids and said, look, do you want to get a game going? Yeah, was the answer. Well, here's what you have to do. Call the boys in and be a leader and choose up sides. And ultimately they did. And, they seemed to have a good time with it. But, it is shocking maybe to you and I that you have to introduce this stuff, but sometimes there does need to be a growing up in the room, especially for a generation of youngsters that haven't had to do it on their own.
So last question, here's the $1 million question, I think, for a lot of parents. You talked about you're enjoying this time slowing down, right? And being able to have family dinners and see each other. When organized sports do return, do you think yourself and other parents will take the lessons you're learning right now and slow down in the future, or is it back to the rat race and the hectic schedule?
Yeah, it's a really good question. And, I don't know the answer. I hope that they will. I hope I will. To be honest with you though, John, I probably won't. To some extent, we're at the mercy of the organizations, the youth organizations that organize play and organize the teams. And I think it really starts with the organizations deciding on lengths of seasons, and it also starts with individual coaches deciding on when they should start off-season workouts, or if there should even be off-season workouts for children who are say younger than 14. I think those are serious questions. So my kids do enjoy playing their sports, and my wife and I have really enjoyed watching them over the course of the years, watching them grow, helping them develop. It's been a great joy. But I do think it's incumbent upon all the grown-ups in the room, as I say, the organizations in particular and the coaches, to sort of come to some agreement about the lengths of seasons, the number of practices, the number of games, the amount of travel. That's another huge thing. I hope that recreational leagues, the leagues that were the foundation of youth sports for so many generations before tourism bureaus and for-profit organizations got involved, can step up their efforts and offer a level of play that's competitive enough, but also sane enough that people can participate in. I think this is a big opportunity for recreational leagues to step up.
No, we absolutely think so too. Recreational parks and rec leagues, community-based leagues. It's an opportunity to create a new model. So great thoughts, really appreciate it. Let's now bring back our other panelists, have Omar and Ruth join us as well for our Q&A session. And we want to hear from you as well. It's your chance to ask some questions. I'm going to turn to my colleague, Rania Bautista, for our first question. Rania?
Yeah, hi there. Thank you so much for that really insightful question, conversation. And actually, we'd like to kind of kick off with the last point that you were making, Dave. and maybe bring Ruth into the conversation as well. Received a lot of questions about, given the guidance from the CDC and the forthcoming return to what are some of your suggestions for parents who are pushing for coaches to practice as a team against or aligned or not aligned with the current recommendations? So how would you recommend kind of communicating with those parents and those coaches? Maybe David, let's start with you and then go to Ruth.
Sure. I don't think any coach should of any level of play should be putting a team sport or team camaraderie above safety. I for one would listen to the health experts. If the health experts are telling us that social distancing is necessary, let's abide by that. There may be drills and exercises that teams can do where they don't have to get together in such close proximity. I don't know what those look like right now, but I would encourage coaches to be inventive about that. But really, first and foremost, I would really encourage coaches to listen to the advice of health experts, no matter, I know in some parts of the country, this doesn't feel like a pandemic in the way that we might envision. But, there are very smart people out there who know, who are offering advice. I suggest that we take it, and parents shouldn't feel pressured to participate.
Thank you, Dave. That's great to hear that people believe in paying attention to the public health and medical experts here. I obviously agree with Dave's comments, but I would suggest that what could be particularly helpful is for coaches themselves to encourage some of this at-home play. Not just the parents, but the coaches who, I understand it's a difficult time for them, but I suspect there are a lot of kids who look up to their coaches. Coaches can help explain the situation, that there will be a time when everyone will come back as a team and pick up where we left off. But in the interim, here are some things that kids with their families can do to stay in shape so that they'll be ready when team sports come back.
Great. Rania, next question.
Yeah, and so Omar, you also mentioned, kind of varying activities and creating a schedule with your daughter. Can you share some insights about how you worked with your daughter to create that schedule and how you've maybe kept her motivation up through creative play?
Well, we have to let her wait until she's in the mood, because I don't want to push her into something that then she's going to regret it or she's going to get bored of it. And what I'm listening to this conversation is going through my mind. Let's not try to push the kids to do activities. Let's just wait for them to get into the mood of things. They can have their breakfast, they can have their lunch, and then try to go and do the activities with them. Because what I find out throughout all these years that I've been working in baseball is, like, if you try to push a kid to do an activity and they don't want to do it, they start hating it and they start getting bored of it. So do it in their own time, where they feel comfortable, where they feel like there is a time to do it, and then do and be the leader and take care of the activities. But while this time is going on, it's very hard to try to get all the kids to do things, especially when they have all the video games. And that's something that we're trying to get away in this time. We just don't want to be sitting in the room playing video games for 5 hours in a row. It's going to be some time where we have to encourage them to do these activities.
Absolutely. And with that, it was mentioned how much joy you played with. How have you kind of injected that same mentality in the way that you are playing with your daughter, and especially in a time that might be of high stress and high tension?
Yeah, just try to break the ice, trying to bring a competition where we can bounce the ball off the wall 10 or 15 times without dropping it, and try to create these games where they get excited about. Don't win all the time. You got to let the kids win every once in a while. I think that's important for them to kind of get confidence and keep playing the game. So that is the best way is to get creative. Let them invent a game. Let them create a game where you can go alone and then try to participate on these games.
Excellent. I love that. And similarly, David, what are some ways that, you might recommend, parents can work with their kids during this time to maybe fall back in love with a sport that they might have fallen out of love with or that they've lost interest in? Do you see this as an opportunity to work with them on that?
I have to tell you, if I think kids, like Omar said, you've got to wait for them to make the move. Sure. If your kid is in front of a TV all day and playing video games, yeah, you want to sometimes, kick them outside and tell them to get some exercise. Fair enough. But in terms of falling back in love with the sport, I don't know that there's much that can be done. I certainly there are exercises you can do to keep skills sharp, but in certain sports, but that's if a child, I think, wants to do it. And that child, I believe, will let you know that he or she wants to do it by their own actions. They will find that way to suddenly pick up a ball and throw it against the wall, or you'll see them walking around the house pretending to do a basketball shot or something like that. That's an indication that they miss these things. And when you see that, that's when I think parents can seize upon it and ask them if they'd like to play. And then mom and dad can get into the game. But in terms of reintroducing or trying to steer them, I don't see it. Kids will let you know when they're ready to play.
Let me jump in here as well. I'm going to ask a question for maybe Omar and Dave. As parents, return to play is going to be a big topic. We're going to continue to hear, of organized sports when we actually get these sports back up in the near future, when it's safe to do so. And it may vary, state by state, location by location, depending on what the outbreaks are like in those areas. As a parent, what will determine for you when they can play again? How would you feel about letting your children play organized sports again anytime soon? Omar, you want to try that first?
Well, I don't think it's up to us, John. I don't think that we are the one making that decision. I think we have to listen to all the organizations and the health people to let us know when is the right time to do this. Because, let's face it, sports, any kind of sports, you need people around to kind of like raise the level of adrenaline. And without the people in the stands, without the people that are watching you, they're clapping for you and they're booing you or doing whatever, we have no sports. The fans are the one that make our sport interesting and raise the bar to a different level. So we have to wait until we can be in an environment where we can enjoy these activities. We can give a hug to people and share a clap and, raise the glass of a beer or something because your kid just hit a home run or he scored a goal, and doing all these things. So, we have to be patient on this. We got to introduce it little by little and make sure that the most important thing for everyone here is the safety of everybody. As long as we're safe and we're doing and we're sharing everything, then that's when it's going to be a right time to do it.
Mm-hmm. Dave, how about you? I mean, what's going to trigger where you're going to feel comfortable to let your kids play organized sports?
I'm not sure I have much more to add, John, to that. I think Omar said it perfectly. Really, we have to sort of wait and see. Patience is key here, and listen to the experts, and hopefully that the youth sports organizations will listen to the experts too, and determine when it's safe to do these things and to return to play. And in terms of kids like losing a step, if you will, that's a concern for some parents. First of all, I would ask if it's a concern for the kids. But nevertheless, it is a concern that has come up. And the way I see it is, look, this is leveling a playing field here. No one can play right now, organized sports. So you're not going to have that kind of competition. One thing that can set some kids apart if they're looking to excel in the future when the games come back is, like we've talked about for the last 45 minutes or so, staying active at home.
Ruth, any medical advice from a health expert, what parents should be listening to?
These guys have summed it up perfectly.
Great. Rania, do we have some more questions?
Yes, absolutely. Also very much apologize. My internet has gone out, but I'm back. Ruth, we've received some questions about the guide and how, what kind of went into the process of creating it, particularly looking at the experiences for youth with disabilities. Can you speak to that a little bit of how that was incorporated into the guide?
Well, the guide itself looks at a variety of different activities and sports, most of which as I said in my remarks earlier, focused on what individuals can do. And for each one of the activities or sports that we take up in the guide, we assign a risk. Well, there's 3 different categories of risk for each activity that we're talking about. What's lowest risk, what's medium risk, what's highest risk. And again, individuals can read this and decide, given their own situation, which again, we're talking about whether you can go outside a little bit, but you're with your family members with whom you've been living in the household. So you have kept your social distance, so to speak, whether or not you're using equipment, that sort of thing. So for each category, for each sport, we have a low, medium, and high risk. We have not separated out by any sort of population. To the extent, I will say this, you will find in the guide a reference for each specific activity, additional information, additional resource information from organized sports organizations related to that particular activity. Within that additional information, there may be information that speaks to specific populations. The guide itself is much more general than that.
Excellent. Thank you for that guidance. As we're thinking about, parents themselves, Omar and David would also love to hear from you about some ways that you might have been thinking about, self-care so that you can support playing with your kids. Are there any tips that you can share with other parents about, how you've been kind of staying active, staying well, both physically and health and mentally?
Yeah, like I said before, it's just a matter of staying close in your environment, trying to take advantage of the time that you have with them, and obviously go out in the garage or go out in your yard or do these kind of enclosed activities with your kids.
Yeah, I mean, I would just add that this is a difficult time for a lot of people, being sort of sequestered, not able to get out, not able to socialize. Find that time to stay, mentally all right mentally by hanging out with friends as best you can, through Zoom chats, whatever it is, finding ways to socialize, finding ways to connect to the world outside. I mean, I think that's a way that people can stay mentally healthy throughout all of this. And of course, find the time. There are a lot of solitary activities that you can do to stay healthy. And for me, a lot of that just involves playing with my kids when I get home. So it's been a lot of fun, actually.
Excellent. Yeah, and to kind of add on to that, you mentioned, Omar and Dave, you've both mentioned playing with your kids as a huge element of, maintaining that family time and also the physical activity piece. What are some ways that maybe your kids have been engaging with other kids in ways that have been healthy, so that they are not playing alone, that they're kind of connecting with their peers as well as, with you as adults?
Well, in my case, I don't have anybody around my house that we can play with anyway. We just move into a new community. But for people that live in big buildings and they're around kids, it's gotta be really hard. All you want to do is just play with your friends. When you're a kid, you just want to play with your friends. And it's really hard to explain them why we cannot get in touch with other people. We have to remind them all the time of the kind of danger that they're running. They're running to play with other kids, and that is something that we have to explain to them in the everyday basics. It's so hard. I have a sister that have two kids. He's 8 and 6, and these guys are dying to get out of the house. But it's, you know, they don't understand the danger where they can face if you play with your friends, or when you're out on the street, you're touching all these things, and then you put something in your mouth, and all of a sudden you got the virus. So we have to let them know. We have to explain what's going on in the whole world, not only in your community, but in the whole world, that it's a virus that is very dangerous.
Well, so as I said, you know, my wife and I really eschew video games, and you know, during the regular school year, we don't allow our kids to play them during the week, except for Fridays, Saturdays, and Sundays, you know, at basically weekends. And that's when they have the time, when they're not doing, you know, other activities. That being said, you know, video games are not like they were when, you know, we were kids. You know, they were really solitary activities at that time. You know, there is a lot of socializing that can go on with video games. That it has allowed my kids through Xboxes and PlayStations to stay in touch with some of their friends. Now, again, you know, this is a panel that's supposed to be talking about good health and outdoor healthy activities. I don't want my kids sitting in front of video games, that's for sure. But it has been an outlet for them for sure. On another note, you know, one of my sons recently went fishing with another boy. You know, we talked to their parents ahead of time to gauge whether the parents of that boy had been obeying social distancing guidelines. We felt safe about it. The kids stayed apart. They got together for an hour and a half, and I think it did them a world of good. And that's something that, you know, parents, I think, have to. That's an individual decision. But I certainly wouldn't recommend, you know, playing one-on-one basketball or something like that. But if you can find outdoor activities, riding bikes, fishing like that, where kids might be able to get in touch, if the parents feel good about it, if they're able to maintain a safe physical distance, then I think that can be an alternative.
I would just add, it's important from a medical point of view, from a mental health point of view. It is important for kids to be able to, even if they can't play team sports, it is important for them to remain in touch with their friends. And as Davis pointed out, there's lots of ways to do that besides going out on a basketball court. So we don't want them to lose touch. We want those friendships to remain and for them to have interaction with folks other than their families inside their house. But there are ways to do this, as well as engage in some kind of physical activity.
Randy, I think we have time maybe for one more question.
All right, fantastic. Ruth, would just like to actually go back to you to continue on this point a little bit of, do you have any guidance for how parents should be talking to their kids about this transition and kind of a phased comeback to play, whether it's guidance through the return to play kit or your medical expertise?
Well, I think I would explain to kids, first of all, that it's not just kids that are undergoing this very unique, difficult time, that mom and dad have to stay inside too. And so it's not just about them, it's about the whole family. And that as a family, they are going to transition back to hopefully the way things were, at least almost the way they were. Maybe things are never going to be quite the same in lots of different ways. And then we have to take it one step at a time. And that the first steps might be, or the steps that we can take now are to try and engage in physical activity at home with some of the suggestions that you've heard about today. And eventually they're going to go outside, be able to go outside. Maybe, for example, ride their bikes with their friends. Right now they can ride a bike by themselves, but once again, begin to ride with their friends, eventually leading up to team sports, group activities like they did before. My own experience has been sitting down, being honest, explaining where we are. Of course, in terms that kids can understand, they appreciate it. And at the end of the day, they kind of get it.
Great. Thank you so much. Actually, I lied. I have one more question. Omar, I would be remiss if I didn't ask you because my 11-year-old son loves baseball and he wants to know how in the world you do that quick glove trick where you get the ball going right off your glove and you immediately catch it. And go look on YouTube if anyone wants to see what I'm talking about, because it's ridiculous. How long did it take you to work on that?
Well, if you bounce the ball off the wall for years and years, you will develop this technique, I would say. So tell your kid to start doing the wall drill and to bounce it off both walls, and he will get good at it.
See, they're developing skills for when they're going to go back and play.
Exactly.
That's
Perfect.
right. That's right.
Well, thank you all so very much. We really appreciate the conversation. Thank you all to our panelists, Omar, Ruth, and Dave. Terrific conversation about play, and we hope that this has been knowledgeable to all of you, our Project Play Network. Thank you to our Project Play team of Emily, Rania, Tom, Jennifer, Marty, and Fumi for helping to put this together. A quick reminder, please sign up for our newsletter at as.pn/pp subscribe. That's where we'll be sharing our upcoming webinars for leaders, parents, coaches, and others. We'll dive deep into strategies to really help you navigate these uncertain times and empower you to be an effective change agent. And if you aren't already, you can follow us on Twitter and Facebook at Aspen in Sports for the latest on our Project Play reports, as well as our news and resources. So thank you all very much. Stay safe, be well, and we'll see you all soon.